Hi, my name is Lena Morgan, and this is my health assessment exam from Maryville University. I've asked my patient to empty his bladder. I've asked him to put on a gown. I've checked his vital signs, his height and weight. I will not be performing distance Snellen chart. I will move on to his head and his face, and the first thing I will do, I will inspect it for his skin. I will inspect his skull. I will inspect his scalp. I'm going to palpate his scalp and his hair. I'm going to palpate his frontal sinus regions. Frontal bone, sinus regions. Any pain? Do you feel any pain or anything like that? Temporal mandibular joint, any pain here?
No.
Okay. The next thing I'm going to do is I'm going to ask you to smile. I'm going to ask you to clench your teeth. I'm going to ask you to puff out your cheeks. I'm going to ask you to stick out your tongue. I'm going to ask you to squint your eyes shut real tight. I'm going to ask you to wrinkle your forehead. Okay, thank you. The next thing I'm going to do is I'm actually going to test your light sensation. So I'm going to grab some stuff to test your light sensations. Okay. And I'm going to tell me what you feel at this point.
Soft.
Okay.
Sharp.
Okay.
Sharp.
Okay.
Soft.
Okay, so you're testing your light sensation. I just want to let everybody know I'm really, really sorry because there's just some background noise. I'm at the doctor's office right now during working hours. Okay, I'm going to move on to your eyes. I'm going to inspect your eyelids and your eyelashes. I'm going to palpate your lacrimal apparatuses. I'm going to check your sclera conjunctiva. Okay, thank you. The next thing I'm going to actually do is I'm going to do your near vision screening exam and your cover on cover as well during this time. Okay, near vision screening test and your cover on cover. Okay, so can you please tell me this word?
Ouchless.
Okay, now I want you to look right here, focus on this actual paper. I'm going to put it right here. And I want you to focus on it. Okay, keep focusing on it. Cover on cover. Very good. Good job. You did a good job on the cover on cover test. The next thing I'm going to do is I'm going to start off by doing some bone conduction and air conduction. Is that you can hear that?
I can hear it.
Okay, tell me when it stops. Okay.
It stops.
Okay. Tell me when it stops. Okay?
It stops.
Okay. And now I'm going to do some extra ocular movements. Okay. I'm going to put this right back here. I'm going to palpate your auricle. Okay. I'm going to inspect your the symmetry and alignment of your ears to your eyes, essentially. I'm going to now I'm going to get the otoscope. I'm going to check for your tympanic membrane actually right now. Okay. Really great, very nice. Really great, very nice. Okay, now I'm going to put this back. I'm going to do his whisper test. I'm going to stand behind you and I'm going to whisper some words for you.
Hi. How are you? Hello.
Okay. Nothing special, I'm sorry. And the next thing I'm going to do is I'm actually going to move on to your neck. I'm going to check your symmetry, the smoothness of your neck. I'm going to check for resistance. Can you resist me? Shoulder shrug. I'm going to look at your tracheal position. Very good. look at your thyroids. I'm going to check your separately. Carotid pulses separately. Okay. And I'm going to auscultate it now. Okay. I'm auscultating your carotid pulses. I'm actually going to auscultate for your thyroid as well. Okay, I'm going to actually check the patency of your nose. I'm looking at your nose structure. I'm going to have you breathe outwards. Breathe outwards. Check if it's midline. If your septum is midline. I'm sorry, if your septum is midline. I'm going to check your turbinates, mucosa on the inside, and septum right now. I'm going to just get a light. Sorry, I don't have a light. And I'm going to, can I have you check your septum? That's okay. Very good. I'm going to have you, I'm going to look at your lips right now. And what I'm going to do when I look at your lips is I'm going to have you open your mouth now. I'm checking your orthopharynx, your hard, your soft palates. I'm looking at your teeth. I'm looking at your tongue. I'm looking at your, stick out your tongue for me. Thank you. And can you stick your tongue back in? I'm looking at your soft palates. Again, buccal mucosa. Can you open your mouth? I'm checking for uvula. A little more, sir. And tonsils. Very good. Everything looks good there. And the next thing, no mouth odor or anything else like that at that point. So now I'm actually going to put this back. I'm going to go on to your extremities. Okay, so now I'm going on to your extremities. And I'm going to, first before I do that, I need to do your ah and gag reflex. So I'm going to actually do your, the gag. Oh, okay. Have you gagged? Oh, I'm sorry. Okay, can you say ah?
Ah.
Okay, just without your mouth open. Can you just say ah for me? Okay, the next thing I'm going to do is I've already done his neck. So now I'm actually going to move on to doing his lymph nodes and preauricular, postauricular, occipital, tonsillar, submental, submandibular, superficial, cervical chain, posterior cervical chain, deep cervical chain, supraclavicular, infraclavicular, and axillary. The next thing I'm going to do is I'm actually moving on to your hands. I'm inspecting your hands, your arms, your shoulders. I'm looking at your nails. Looks very good. I'm gonna check any your hair distribution. Everything looks really good. I'm gonna check your pulses. This is your brachial pulse. Okay, radial pulse. Okay, very good. I'm going to look for any jugular vein distension, and I see none. I'm going to go on now to your back. Unfortunately, I'm not sure exactly how the camera can get me, but I'm going to have you turn around towards me. Oh, sorry, the other way. And I'm looking at your back. I'm inspecting your thoracic configuration. I'm actually going to percuss your coastal vertebral angle, and I'm actually going to palpate it as well. Okay, now I'm going to check for your respiration, your expansions. Keep doing one more time. Can you please tell me 99, 99? Tactile fremitus is 99, 99. Sorry,
99, 99, 99, 99.
Okay, now I'm going to percuss your chest, posterior chest. Okay. I'm still percussing his posterior chest in this moment. I'm very sorry. His lateral chest. Again, I'm really sorry you cannot see. This is just me. I'm percussing this way across his chest. Now I'm going to do his diaphragmatic excursion. So what I'm going to have him do is I'm going to have him exhale and keep it, please. Okay, now I'm going to have you take a deep breath and keep it, please. Okay, it's about 5 to 6 centimeters, which is normal. The next thing I'm going to do actually is I'm going to auscultate his chest. I'm going to do side to side, comparing each side, and I'm going to do on the other side. So here I go. Okay, sorry, lateral. Okay, now I need you to please lay down. And I said this already, but I just want to mention again in case I did not, that I actually did inspect his respiration. I don't see anything abnormal. I did not hear anything abnormal. Now I'm going to have you lay down and scoot down just a little forward just so that way the camera can see everything. And right now I'm moving on to the chest and just making sure that everyone sees the chest. So I'm going to I'm going to look at his the skin of the chest, the symmetry. I'm going to check and see if there's any pulsations, any heavings. I'm going to palpate his chest wall and his pericardium. I'm going to locate his impulse. The next thing I'm going to do is I'm going to percuss, check for inspection here. So first I'm going to percuss. Can you please say 99?
99, 99, 99, 99.
And please breathe. Okay, now I'm going to actually listen to your breath sounds and your heart sounds, sir. Take some breaths for me. Okay, and so actually, look, this is the apical pulse. I forgot to locate it. Here it is. Okay, and I'm going to do his heart sounds. Aortic, pulmonic, herbs, tricuspid, and mitral. Okay, this is the mitral valve. Now the next thing I'm going to actually do is I'm going to go on and I'm going to go onto his abdomen. I'll be checking for his contour. Also, I was on his chest. I did check for any pulsations or any thrills or any heaves or anything abnormal, and I did not notice anything. So now, again, let me move on to the abdomen. And I'm checking the contour, the movement of the abdomen, any pulsations, midline aortic, no pulsations there. And now I'm going to do a various amount of tests. It's a lot with the abdomen. So the next thing I'm going to move on to is I'm going to do some light palpation. Okay, now during the deep palpation, I'm going to tell you what I'm right for liver, kidney, spleen. Okay, the next thing I'm going to do is I'm going to check his arteries. Okay, aortic, kidneys, renal, the iliac. So iliac, femoral, sorry sir, femoral. Okay, the next thing I'm going to do, I'm continuing on the abdomen. I'm going to check for the liver tone. Okay, liver tone. The next thing I'm going to do as I'm here, I'm going to check for the liver borders. Can you take a deep breath out and hold it? Okay, now let go. Now take a deep breath out in and hold it. Okay, the next thing I'm going to do, I'm going to go over here actually right now, and I'm actually going to check for some splenic dullness. So I'm going to go right here, and I'm going to have you, I'm just going to start by hearing it. And now I need you to take a deep breath and hold it. Okay, I don't feel his spleen, so it's normal. I'm going to check for his bowel sounds. Sorry. In all 4 quadrants. I'm going to check his abdominal muscles. Can you please squeeze, like, go upwards, like as if you're making a crunch, like a crunch. And, okay, very good. Now, please lay back down. Thank you so much. The next thing I'm going to do after I've done everything, the abdomen. Again, I haven't noticed anything abnormal with the abdomen. There are, again, no aortic pulsations or anything of the sort. So what I'm actually going to do at this point is I'm actually going to move down to his feet and his legs. And at this point, what I'm looking for really here is I'm looking at his I'm feeling for his temperature. I'm looking at his muscle mass. I'm just his hair, hair distribution. There, you know, the temperature is normal. Any edema. I'm doing his pulses. So dorsal pedialis pulse, popliteal pulse, posterior tibial pulse. Okay, everything looks normal there. And now I will have the patient actually stand up. Sir, can you please stand up? Stand towards me. Okay, and now, oh, sorry, no, please have a seat.
Oh.
Okay, now that I've done his feet and his legs, I've checked, again, I was inspecting his muscle mass and everything else. And now I'm actually going to move on to your neurological exam. So the first step to your neurological is 12 cranial nerves that I'm going to be testing. And the first thing I want to do is I'm going to walk over here and I'm going to get something for you to smell. And you're going to close your eyes right now because I'm going to get it and you're going to tell me what it smells like, okay? So I'm going over here. Okay. So can you tell me what you smell?
Nothing.
Okay, good. Actually, he should be smelling nothing because hydrogen peroxide has no smell. So this is correct on here. Okay, the next thing I have doing right now is the cover-on-cover test again because this is cranial nerve 2. Okay, so I'm going to have you actually look at a plug. Let's look at this plug today, okay? Keep looking at it. Good. So that's cranial nerve number 2, which he did really, really well. Now cranial nerves number 3, 4, and 6 will be tested. And I'm going to have my finger move towards you, away from you. Okay. Thanks so much. The next cranial nerve that I'm going to be doing is cranial nerve number 5. And I'm going to be, I just need to take a cotton swab over here. And cranial nerve number 5 is, sorry, my phone, I need to dismiss something here, I apologize. Okay, cranial nerve number 5, and I need you to look up and away. So look up and away with your eyes, just with your eyes, sir. Look up and away. Okay, his pupils started moving towards the cotton swab, which is normal for that. Cranial nerve number 7 was the facial nerve, which that's how I tested that in the beginning with clenching his teeth, tightening his eyes shut, doing all of that. And then, so now we're moving on to cranial nerve number 8. So I need you to please close your eyes again. Tell me, what does this feel like to you? Sound like to you? Sorry.
Like brushing?
Okay. How about this?
Brushing.
Okay. It does feel like a brush sensation. Okay. Cranial nerves 9 and 10 I had already tested earlier, and that was the gag and the ah reflex. But I'm going to do it one more time for the purposes of this exam. So can you please hold? Okay. I need you to say ah.
Ah.
Okay, I'm going to gag you now. I'm sorry. I know I'm sorry I keep having to gag you. Okay, I'm going to do cranial number 11. Please shrug your shoulders. Okay, stick out your tongue. That's cranial nerve number 12. And I'm checking for symmetry. I'm checking for any abnormalities or anything else like that. Again, I'm at a doctor's office. I'm so sorry if you hear any background noise. I keep hearing people walk, so. Now I'm going to check for your sensation. So I'm going to have you close your eyes, and I'm going to ask you, can you tell me where you feel me touching you?
My pointer finger. My thumb. My leg. My leg. My belly.
Okay. And how about this?
My hand.
Okay. Very good. One more time.
My hand.
Okay, very good. I seem to like this test a lot. So, the next thing I'm going to do, is I'm going to, now we're done with the neurological exam. Now we're going to move on to your musculoskeletal exam, okay? Sorry, cervical. I'm looking at the cervical spine. Can you please bend down? Can you put maybe your back outwards? See if anything looks. Cervical spine, lumbar spine looks really, really good. I'm checking for his muscle strength. Can you stand up? Actually, let's stand up during this. No, I can't have you because the camera will not see. I'm sorry. I thought it'd be a little easier for me. But I checked your cervical spine, checked your lumbar spine. I'm going to actually do your reflexes right now. So, okay, so your knees, okay, right here. I'm doing your Achilles tendon. Okay, I'm doing your brachial now, reflex. Okay, brachial. Okay, thank you so much. And I've checked his muscle strength. I've checked everything out with him. I'm just gonna take a moment and just think if I miss anything before I conclude our exam, if you don't mind. I did not find anything abnormal with this exam. Everything looks good to me. I mean, he's able to do that. He's passed. All his cranial nerves are intact. I've checked all his pulses. I've checked everything. I really have found no abnormalities. So, the last thing I'm going to do is I'm just going to conclude my exam. Thank you so much. And this is the conclusion. And I did not find any abnormalities, as I had said already many times. Thank you.